The following videos demonstrate how to operationalize patient-centered counseling about reproductive goals and contraceptive preferences using the PATH framework. This framework is a concrete set of open-ended questions and counseling skills designed to effectively engage with patients about their reproductive goals and, when appropriate, pre-pregnancy care, contraception, and infertility services. PATH is an acronym. The PA stands for parenting or pregnancy attitudes, the T for timing, and the H for how important it is to prevent pregnancy. PATH asks the following 3 questions. For the PA, do you think you might like to have children at some point? Or if the person's already had children, do you think you might like to have more children at some point? The T, when do you think that might be? And the H, how important is it to you to prevent pregnancy until then?
So you're in your 3rd trimester now, and things have been going great, minus this little cold that you've got. Since we're entering the home stretch, it might be a good time to start talking about the future.
Jen begins the PATH conversation as a natural transition.
Do you think that you're going to want to have more children at some point?
We're a big family, and we have so many bills to pay each month. I'm definitely not asking for another child. Mm-hmm. But if he comes, I'm not going to be upset. You have this love for your children, and you've created them. Mm-hmm. You rise to the occasion and don't stop to think about all the bad things.
It is clear from Jen's body language and facial expressions that she is listening. She responds with validation, pointing out a positive without judgment or bias. Jen merely responds to Jayda as a unique individual with no agenda other than to learn about Jayda and build rapport.
That's really beautifully put. So, how important would you say it is for you to prevent pregnancy?
It's important to me. But if it happens, I'll be a little shocked. I'll be happy. I'm not going to be mad. I'm not going to be mad at all about it. I'd be happy. No matter what the situation is or whatever, you have to take care of them. It really wouldn't be a big change, just another baby.
Jen uses a type of paraphrasing where she puts one of Jayda's desires, not to have any more children, on one hand, and the other desire, to be happy with another child, on the other hand. Apparent ambivalence does not need to be resolved. This technique shows Jayda the 2 desires so she can think about it and perhaps prefer one hand over the other. Jen uses the word but. Usually the word and is preferred when using the on the one hand technique.
So it sounds like on the one hand, you and your family would adjust if you had a new little one. But on the other hand, you'd ideally want to prevent pregnancy. And medically speaking, it's a good idea to space pregnancies by more than a year and a half or so. So that said, do you think this would be a good time for us to talk about ways that you can prevent pregnancy?
We've been talking about getting my tubes tied, but I'm just not ready for that yet. I breastfeed my kids, and I never get pregnant while I'm doing that.
Jen does not rush in to explain about lactational amenorrhea yet. She starts with pointing out something positive and building on what Jayda knows. Notice the many times when Jen validates, agrees, or empathizes with Jayda throughout the vignette.
Well, it's great that you know that breastfeeding is important and great for your kids. And if you're breastfeeding 100% of the time, for 6 months, it's a very effective way of preventing pregnancy until your period comes back.
And it's good for losing the baby weight.
Yeah.
I'm truly dedicated to nursing. I tell all my friends about it.
Well, thank you for being such a champion for breastfeeding.
Jen asks Jayda if she has given thought to what she might do after the baby is 6 months old, thereby emphasizing the point that LAM is only effective for 6 months without having to correct Jayda.
Have you given any thought to how you might prevent pregnancy after the baby's 6 months old?
Well, I usually breastfeed longer than that, but yeah, I do get my period after the baby's taking food. So you're saying that nursing won't protect me once I get my period again?
Jen agrees with Jayda, is impressed that she figured it out, and uses a visual aid in plain language to give information about return to ovulation. Then, notice the phrasing and Jen's use of plain language. Your ovary is already back at work putting out eggs.
That's exactly right. So breastfeeding is telling your body that the ovary shouldn't release an egg.
That makes sense. It's like nature's way of helping us not to have too many kids. I love nature.
That's a great way of thinking about it. Can you tell me what you know about ovulation?
Well, I did know that ovulation is when you can get pregnant and you can't get pregnant the rest of the time.
Exactly. And when you get your period, it means that 2 weeks prior, your ovary's been back at work putting out eggs.
Which means you can get pregnant.
Notice that Jayda herself expresses the importance of discussing contraception without Jen inserting any bias or opinion. This is a natural transition to the question, do you have a sense of what's important to you in your birth control method? Followed by paraphrasing. Notice the several times Jen paraphrases during the vignette.
Interesting. Okay, so let's talk about how I can not get pregnant after that happens.
So, do you have a sense of what's important to you in a birth control method?
Well, I'd still be nursing, and I won't take a pill or a shot or anything like that while my baby's drinking my milk. They say that's fine, but that's not fine with me.
It seems like not using something with hormones would be very important to you. And the most effective method that doesn't have hormones is the copper IUD.
No, I've heard about those. I don't want anything or anyone messing with me inside. Sammy will just use condoms if I tell him he has to.
Jayda clearly expresses mistrust with the medical community, likely based on her lived experience or the experiences of people whom she is close to. Her reaction is clear from both her words and body language. Jen is respectful of this. Some people's objection to a device needs further clarification with things like, "Can you tell me more about that?" But in this instance, Jayda is clear.
Okay, so it seems like it would be important for you to have a method that you can manage or control yourself. Is that right?
Jen paraphrases and then offers to discuss fertility-awareness-based methods. Jen does not make assumptions about Jayda's motivation or ability to adhere to a method that requires active participation on the part of the user.
Well, yeah.
Okay. And remind me, your periods are regular every month when you're not pregnant?
Yeah, every 30 days.
Okay. So let's talk about this method, which is called fertility awareness. Fertility awareness tells you when you might be most at risk for pregnancy and when you're not. Some people also call this natural family planning.
Okay, that's what I'm talking about. Mother Nature.
Yeah, it's all about tracking your periods and ovulation so you can know when not to have sex or when Sammy should use a condom. Seems like that might be something that appeals to you to get to know your body's patterns better.
You know, I love to learn about my own body. And Sammy doesn't love condoms, so if he doesn't have to use them some of the time, that'd be good.
Okay, so there's a lot of different ways to do this. One is this app.
Notice Jen's use of visual and tactile aids.
That helps you track things. And then also there is the lower tech method of cycle beads. We have some classes here that you could come to, or you and Sammy could do them together.
Jen asks, what are your other questions about fertility awareness-based methods? Rather than, do you have any questions? Which is more likely to shut down Jayda's questions. Jen doesn't just leave it open-ended, what questions do you have? Because she wants to invite focused questions.
So what are your other questions about fertility awareness methods?